My name's Dr. Anna Cadogan, and I am now chair, having become trustee this time last year, of FRAME. May I introduce Dr. Jarrod Bailey, who will be talking about the analysis on the use of dogs in predicting human toxicology and drug safety.
Okay, good evening everyone. It's a pleasure to be here. It's a real thrill, having been to this several times in the past and sat out there, to actually be up front and be talking about some work I've been doing. So thank you to Frame for inviting me, and thank you to you all for coming. So the first question I think really is, well, why did we study dogs? Well, the first reason is a big reason. There's a huge amount of public concern over the use of dogs. There was an independent opinion poll just a few years ago in 2009, right across the EU, including in the UK, that showed well over 3/4 of the population disagreed or strongly disagreed that experiments on dogs that cause pain or suffering should be permitted by law. And this was one of the main, a main impetus for a current campaign of the BUAV called Our Best Friends, which seeks to translate that public opposition to the use of dogs and cats in research into a meaningful change in practice and attitude, and it's gathered tremendous support so far. In the US, public objection to experiments involving dogs and chimpanzees is also in the majority. It doubled between 1985 and 2008. And all of this transatlantic public concern, certainly in the EU anyway, is reflected, at least in principle, in many conventions, directives, acts of member states, which, as we all know, stipulate that experiments have to be essential for a given purpose, that the number of animals, the number of dogs that are used has to be kept to a minimum, pain and suffering has to be reduced to a minimum. It all has to be ethically justifiable. Alternatives should be used wherever scientifically satisfactory. Despite this level of concern and ostensible regulatory control, significant numbers of dogs do, however, continue to be used. The number is actually still going up. And this leads to our second reason for looking at dogs, which is that dogs are still actually heavily used in science, particularly in drug testing. There is, of course, a general assumption that testing drugs on animals informs the situation in humans. It helps to ensure that drugs are safe and drugs are efficacious. And this assumption means that there has been for a long time the two-species paradigm in testing. Again, most if not all of us will know this. Drugs are tested in a rodent, normally a rat, and a non-rodent, normally a dog, for this purpose. And of course, this in itself is evidence of the major flaw in animal testing, which is you can't reliably extrapolate information from one species to another. That's why you have to use two, a rodent and a non-rodent, because of its inherent unreliability. The intention is that the non-rodent data, the data from normally the dog, will augment the rodent, the rat data, and will pick up anything the rat might miss. Most recent figures show well over 3,000 dogs were used in the UK in 2012, which is up from the previous year. Across EU member states, well over 21,000 dogs were used, and in the United States, actually approaching 65,000 dogs were used in science in the last year, for which figures are available. So in total, it's likely that around 90,000 dogs are used in science every year across the EU and in the US. Now this of course includes dogs used in research, but the majority of these dogs, certainly in the United Kingdom, figures suggest about 80% or so, are used to test new drugs. So it's the majority of dogs, it's a lot of dogs every year. The third reason that we looked at dogs is that they are undeniably special. They're a special case for consideration. They have characteristics that make them demanding of special consideration. Unlike many other species, dogs are actually an evolutionary product of thousands of years of adaptation and selection defined by the social needs of human beings. And what this means is that dogs evoke really a very strong protective response in people when people perceive that they're being exploited or abused. And this works the other way too, because due to this social selection, dogs need us. Dogs become distressed, they are predisposed to seek and distress in the absence of human social contact. I'm just going to put all of these other things up at once because I'm not necessarily going to do them in this order. But I think it's interesting that dogs are actually superior even to chimpanzees in being able to pick up human cues. And what this means paradoxically is that the beagle in particular, which of course is by far the most prevalent dog used in science, has the greatest separation anxiety of all dog breeds. And the degree of anguish and psychological suffering is evidenced by stereotypes exhibited by dogs in labs, which include a whole host of things: circling, pacing, whirling, jumping, bouncing off walls, biting themselves, repetitive grooming, very grand words, polydipsia and polyphagia. They eat and drink too wide a variety of things that they shouldn't be doing. Compulsive staring, excessive barking, pretty much behaviours that also indicate obvious poor welfare and increased susceptibility to injury and disease. Stress is also particularly a problem in dogs. Dogs have very, very sensitive hearing. Noise in kennels, in labs, is unavoidable, and that noise causes them stress and causes psychological suffering. Restricted sight lines in kennels causes stress for dogs too. Dogs like to be up on high. They like to see what's coming and what's going on around them. And again, ironically, beagles, the most common dogs used in labs, suffer more than other breeds. They suffer more commonly than other dogs from idiopathic epilepsy, which is exacerbated by stressful procedures, such as environmental variation and restraint. And in fact, attempts to ameliorate laboratory conditions for dogs, to try and decrease noise, to try and give them sight lines, actually, to date, haven't really worked terribly well at all. Dogs still become frustrated and bored. And it appears at the very least that a huge amount of more human social contact is a sine qua non. You cannot do without it. Dogs absolutely need it. So, given these things, the degree of public concern for the use of dogs in science, the regulatory guidelines and control, the special status of dogs and how they particularly suffer psychologically, there should surely exist an extremely bomb-proof, convincing case for their scientific value and for their necessity in drug testing. So was there such a compelling case? Well, I don't think there is, and I think the evidence suggests that there isn't. I think it isn't surprising to learn that the concept of using multiple species in drug testing, including the recommendation that the dog is the non-rodent species, there's a lot of evidence to support this, developed, formalized, and established without careful scientific validation. Now, this was a long time ago. This was done in the US in 1944 by the FDA and the American Medical Association. In Europe in 1965 by the European Society for the Study of Drug Toxicity. So it was a long time ago. Arguably, there was some desperation around to do something that probably looks superficially like it might be helpful and it might work. I think the problem is that the reasons proffered since then, and even now, for the use of dogs in drug testing continue to be far from scientific. And I'm going to read some out now that have been published. The ready availability of laboratory dogs, their large size relative to other species, and their small size relative to other species. The ease of housing and handling, the contention of general similarities in anatomy and physiology. Easy access to the cephalic vein for blood sampling, the ability to take a large volume of blood from it. Dogs' gentle temperament and even temper, lack of inherited health problems. A large volume of historical background data, the fact that they have short hair, the fact that they're intelligent, the fact that they're cooperative, they're not demanding particularly with regard to exercise, and that they're relatively cheap compared to non-human primates. All good reasons, I guess, if you work in a lab. But conspicuously absent from that list is the fact that dog data are predictive of, or even helpful in the prediction of, human drug responses. One might expect that going into 2014, after 50 to 60 years of their use, those who advocate the use of dogs in this way would have come forward with something. After all, the biggest advocates of dog use are those who actually have access to all of the data from all of these years of dog testing that is sitting in the basements of pharmaceutical companies. The problem is that this really hasn't happened to any great extent. Repeated requests to make this data available, even anonymized to protect commercial interests, largely have fallen on deaf ears. And the problem is that this makes any real analysis of it very, very difficult, virtually impossible. There are a few exceptions, and what I'd like to do before I go to present the results of our study is go through some of them, because I think it's important to see what's come out of this before our study. So examples include, and here we have on the left, toxicity in animals, rats, dogs, toxicity in humans. As long ago as 1962, there was a study that showed toxicity in animals was rare in humans. I know that's pretty vague, but that was an initial study. Since that time, over the decades following that study, there have been maybe half a dozen or so significant studies that have been done. They all showed that toxicity in animals failed to predict toxicity in humans different percentages of time, so I'm not going to list them all. But the mean is 73%. Half a dozen studies showed that toxicity in animals, including dogs, does not predict toxicity in humans 73% of the time. And there was a more recent study just last year that, quote, expressly set out to minimize any data bias that showed that in 63% of cases, a human toxicity was not reflected in animals. And in less than 20% of cases did a human toxicity have a true corollary in animals, including dogs. Looking at dogs a little bit more specifically now, some studies have been done on drug-induced liver injury, which is obviously important because it goes without saying the liver is the organ that metabolizes and clears drugs, and it's the main reason for the drug failures these days. Looking at drug-induced liver injury, there was a study in 1991 that showed using the dog in addition to using the rat actually provides no advantage to using the rat alone. And there was quite an extensive study of publicly available data, non-rodent data on many, many compounds with a lot of liver-associated assertions. And this study showed that there was a false negative rate of up to 51%. In other words, animals, including dogs, didn't show toxicity, but did show toxicity, the drug did show toxicity in humans in the majority of cases. And the false positive rate was about a third. In about a third of cases, drugs that were toxic in preclinical animals, including dogs, actually weren't toxic in humans. And this study also noted that the dog was actually a worse predictor of toxicity in humans than the rat, and that using the dog in addition to the rat only increased the level of prediction of human toxicity by 2 or 3%. Finally, I think the most comprehensive to date was actually a study by Frame in conjunction with the RSPCA in 1999. And this showed, that's the previous study, this showed that dogs did not provide valuable additional data to the rat in 92% of cases. And in the remaining 8% of cases, dog data didn't result in a change of course in the development of the drug. Now, I've mentioned these studies not at all because I wish my talk to become a polemic against the use of dogs, because I don't. What I'm here to do is to present the results of our study. But I think it is very important in leading up to me presenting our new study to appreciate that studies over the years have been relatively few. In one or more ways, they've been relatively limited. They've been critical of the scientific worth of using dogs. And even though they've been critical, they haven't resulted really, apparently, in any real change of behaviour. Largely, it could be argued that they've been ignored by those who use dogs. There is one exception, one study that absolutely hasn't been ignored, and that's a study that many of us will be familiar with, by Olsen et al. In 2000. Now, this study looked at unpublished data from within pharmaceutical companies associated with around 150 drugs. And it showed that rodents alone, primarily the rat, but other species too, showed 43% of human toxicities. Non-rodents alone, primarily the dog, but not exclusively, showed 63% of human toxicities. And together, actually 6 species, again primarily rats and dogs, but not exclusively, combined, all of these species showed 71% of human toxicities, the collective sensitivity. But I find that odd because basically what this study says is that if you just keep using more and more and more species, your sensitivity will increase, arguably, to 100% or something close to 100%. But that's not a good idea, and scientifically it's not a good idea because it's known that if you increase your sensitivity in this way, you decrease your specificity. Olsen himself said that specificity was not involved in his study. And I'll get on to why that's a bad thing, why specificity is absolutely crucial in a little while. And Olsen said that more complete evaluation of this productivity aspect will be an important aspect of any future prospective survey. But the point is this, without factoring in specificity, it is absolutely impossible to assess the evidential weight provided by the animal models. And this is the crux of our evaluation. I'll get on to explaining why now. So what did we do in our study? Well, we couldn't obtain access to any industry. We tried, and we couldn't. So we obtained all of our data for a fee from a commercial enterprise called InStem Life Science Systems, which Michael mentioned earlier, formerly known as BioWisdom. Now, InStem's Safety Intelligence Program, or SIP, collates data, notably only publicly available data, from several reputable sources. And these include PubMed, FAERS, or the FDA Adverse Event Reporting System, Drug Bank, and the National Toxicology Program. It contains data on more than 80,000 compounds, and with particular relevance to our work, on more than 2,300 drugs, all of which have data for animals and for humans. With respect to our study, of course, dogs and humans. Now, for each of these drugs, the Safety Intelligence Program derives a signature of effects using the databases, and that can be broad on a tissue-based level. So, for example, bradycardia or arrhythmic disorder would be classified broadly as heart effects. But it also maps these signature of effects to biomedical observations, to MEDRA classifications. This is the Medical Dictionary for Regulatory Activities, and there are 4 classifications increasing in specificity as the numbers go down from MEDRA level 4 to MEDRA level 1. And there's a real advantage in doing this. Firstly, it makes the work more consistent. You've got predefined classifications for your effects. Also, it eliminates false positives that can arise from species-specific observations that will not occur in humans. And it also allows rolling up of really specific observations that might not be concordant to more broad levels where you can find some concordance. So, our data set included 2,366 drugs. There were 3,275 direct comparisons of effects between humans and dogs. all mapped to 436 different classifications. 52 of them at a tissue level, 384 the more specific measure classifications. And all of these comparisons were shoehorned into something many of us will have seen before, a 2x2 matrix of results. Briefly, what this does is, if a drug is toxic in dogs and toxic in humans, it's a true positive. If it's non-toxic in dogs, not toxic in humans, it's a true negative. And the other way around, toxic in dogs, not toxic in humans, false positive, not toxic in dogs, toxic in humans, false negatives. All of the results were put into this matrix. Now I'm afraid I'm going to get a bit statistical for a few minutes here. It's absolutely unavoidable, and I've done my very best to make it understandable to those of us, including me actually, who aren't trained statisticians, although I do have some background in statistics. Okay, so this 2x2 matrix, here it is, allows the deduction of and forms the basis of various diagnostic metrics. And we're all probably, hopefully, familiar with the most common, which are the true positive rate or sensitivity, which is the number of drugs that are true positives over the total number of drugs that were toxic in humans, whatever the result in dogs. And also the true negative rate or specificity, which is the number of true negatives, drugs that were not toxic in dogs and not toxic in humans, over the total number of drugs that weren't toxic in humans, regardless of the dog. Now, in many previous analyses, many of the analyses I've spoken about this evening, it's the sensitivity that's being used as the basis of the comparison. But some authors have also focused on something called the PPV, or positive predictive value. And this is the number of true positives, drugs that were toxic in the dog and turned out to be toxic in humans, over the total number of drugs that were toxic in the dog, regardless of their toxicity in humans. The problem is that all of these individual metrics aren't actually suitable for what we want to do. They're not suitable for assessing the evidential weight provided by the test, in this case, the dog test. So to illustrate, sensitivity only addresses the ability of the dog to detect a toxicity that will subsequently be shown in humans. Now, this is necessary to measure the evidential weight that we're talking about, but it's not enough. It's not sufficient. And this is illustrated quite simply. If the dog, for example, always indicates a toxicity that is eventually found in humans, that's pretty good. It's going to have a sensitivity of 100%. The problem is that if the dog always shows toxicity, even when toxicity will not be present in humans, you may as well not bother. Its evidential value, the evidential weight provided by the dog, is negligible. It's as good as just tossing a coin, no better than chance. So the point is, we don't just want to know when a drug toxic in dogs is going to be toxic in humans. We need to know when a drug that's toxic in dogs will not be toxic in humans. In other words, we also have to know the specificity. We have to know the sensitivity and the specificity to gauge the evidential weight provided by the dog to whether a drug is going to be toxic or not in humans. By the way, the PPV is also not appropriate because it's a conditional probability, and what that means is it measures if a drug is going to be toxic in humans, given that we already know it's toxic in the dog. Because it's a conditional probability, it involves the prevalence of toxicity. And we're not interested in prevalence of toxicity, whether a lot of drugs are toxic or whether a few drugs are toxic. We want to know what the dog contributes to any specific drug and its probability of being toxic in humans. I hope that makes some sense. Okay. So, we need knowledge of sensitivity and specificity, which means that what are needed are not positive predictive values or any of the other individual metrics, but something called likelihood ratios. And what we need are positive and negative likelihood ratios. And I'll explain what these are. Incidentally, you'll see that it's not PLR and NLR, it's PLR and INLR. Now what this means is inverse negative likelihood ratio, and it's done for simplicity, and I'll explain why in a little bit. Relative simplicity, I guess. Okay, going back to this 2x2 matrix, we can see that the positive likelihood ratio is calculated as the sensitivity over the reciprocal of the specificity. These are very slow. And the inverse negative likelihood ratio is the specificity over the reciprocal of the sensitivity. So that's a lot of the stats out of the way you'd be pleased to know. Okay. So, the positive likelihood ratio is defined as capturing the ability of the animal model, the dog in this case, to add evidential weight to the belief that a specific compound is going to be toxic in humans. Any model that gives a positive likelihood ratio greater than 1 is contributing to some degree evidential weight to the probability that the compound under test will be toxic in humans. It's pretty similar for the negative likelihood ratio. The negative likelihood ratio captures the ability of an animal model to add evidential weight to the belief that a specific compound is not toxic in humans. Any animal model that gives an INLR that's statistically significantly greater than 1 is contributing some evidential weight to that belief. Now this is another important point, and this is worth noting. A good animal model for detecting human toxicity is not necessarily a good model for detecting an absence of human toxicity. In other words, a high positive ratio does not guarantee a high INLR, a high negative ratio, and this is another key issue in the study that we did. So before getting on to the results, I think it's important to consider just another couple of points about the data. Firstly, potential bias in the data. We know that, of course, false negatives are much more prevalent than false positives. And this is because of a precautionary principle. If something is positively toxic in the dog, it's much, much less likely that you're ever going to see any human data. It's not going to progress to human testing. False negatives is the other way around. Something looks non-toxic, proceeds to human testing, you actually find out it is toxic. So this is a potential bias, but this was limited by, mitigated by limiting our attention to drugs that are in the FDA adverse event reporting database. And of course what this means is that all of those drugs proceeded to market, and we have preclinical animal and clinical human data to compare. The other thing we did was make, well, there is an assumption in this data that lack of evidence for an association between a particular compound and a biomedical observation is actually real. It demonstrates a real absence of a toxic effect. It's not just due to the fact that there's no data. And this is because, again, all the drugs we considered in our data set had been evaluated in both species. The dog and the human data came from all the databases, the FAERS, the FDA, and drug bank databases. So all of this minimized any bias in the data. Finally, moving on to the results. This is interesting rather than important. I mentioned why positive predictive values aren't what we need to look at, why they're not appropriate for what we're actually trying to measure, evidential weight provided by the dog to human toxicity. And this is illustrated here by this scatter plot. And what I did here was rank all of the biomedical observations from best to worst by positive predictive value, and then line up all the positive likelihood ratios for all of those biomedical observations alongside. So in a nutshell, if these two measures, PPV and PLR, were similar, then you would see all of the points along the y=x diagonal line. You don't have to be a statistician to see that they're just completely scattered. There is no relationship between positive predictive value and positive likelihood ratio. And this is illustrated by a couple of examples. One of the classifications, MEDRA level 4 vascular disorder, was the 20th best positive predictive value between dogs and humans, but it was near the bottom for positive likelihood ratio, 404 out of 436. and it worked the other way around as well. Medra level 2 ventricular conduction was the 30th best positive likelihood ratio, near the bottom again for positive predictive value, 406. So positive predictive value has been used at times in the past, and it's not what we need to be using. We need to be using positive likelihood ratio, and hopefully I've explained why we're using positive and negative likelihood ratios, and these bear no resemblance to what's gone before. Okay, moving on to the important stuff, the likelihood ratios. Ironically, this is not going to take me a huge amount of time to say, which I think is ironic because my opinion is the gravity of what I'm about to say is inversely proportional to the brevity. But here goes. Okay. The positive likelihood ratios for the dog were generally actually quite high. The median value was 28. Now this implies that compounds that are toxic in dogs are also actually likely to be toxic in humans. There is a major caveat, which is that the actual values varied considerably from just under 5 right away up to just under 550. But there was no obvious pattern in this range regarding the type of toxicity. So what that means is the reliability of this particular aspect of using dogs cannot be generalized or even regarded with confidence. More importantly, and in contrast, the calculated inverse negative likelihood ratios were substantially more consistent, but their median value was 1.11, just over 1, just a smidgen over unity. The range was just over 1 to less than 2. Now what this means is that dogs provide essentially no evidential weight whatsoever to this aspect of toxicity testing. If a compound shows no toxic effects in dogs, it means that that provides essentially no insight at all into whether that compound will or will not show toxic effects in humans. Now this lack of evidential weight in these circumstances obviously has important implications for the role of dogs in toxicity testing, especially for the pharmaceutical industry. And this is because the critical observation for deciding whether a drug will progress from preclinical to clinical human testing is the absence of toxicity in animals. To repeat, our findings show that in the dog, such an absence of toxicity shows that it provides little or no evidential weight to what will be the case in humans. The predictive value for the dog test in this regard is barely greater than chance than flipping a coin. So we have, we believe for the first time, addressed this salient question. The contribution of evidential weight for or against the toxicity of a new drug in humans by data from dog tests using the most appropriate statistical metrics of likelihood ratios. Furthermore, we've applied these apposite likelihood ratios to a data set of unprecedented scale to critically question the value of the dog as a preclinical species to test new drugs. The quality of the data set, I think, is evidenced by the methods used to source the data, the quality of the databases used to supply them, which have already been mentioned, the ways in which the data have been used in scientific publications and presentations, and the international corporate and academic clients that have used the consultancy and used the data, such as AstraZeneca. Of course, there must be caveats, and there are. Any analysis is limited to the availability of data, the data you can use for your analysis. Ours, as I've said, was limited to publicly available data. We could not get our hands on data within pharmaceutical companies. A lot of this data is unpublished and proprietary for many reasons, and therefore publication bias is an acknowledged problem. And it's one that's confounded by other factors such as the size of the animal studies, the quality of the animal studies, variability in requirements for reporting animal studies, optimism bias, lack of randomization and blinding, and so on and so forth. And altogether, this means that unless one has access to as much free data as possible, the task of gauging the true, actual contribution of animal data, dog data, to human toxicology is pretty much impossible. All data sets, as we know, are imperfect to different degrees, but we've done all we can. All we could do was make sure that the data were good quality and as free of bias as possible, and that any analyses and derived conclusions are as objective as possible. And those of us who worked on this analysis and the associated paper, we did all we could. We didn't mine any of the data. We didn't decide whether there was toxicity or no toxicity. We didn't apply any criteria. So really, my point is, we've done all we can. Here is our work. You have the paper that's been published in your envelopes this evening. If anyone disagrees with it or has any particular issues with it, really it's incumbent on them, particularly people within the pharmaceutical industry, to use this as a platform to get some of their own data, to do their own analysis. We've really been calling on the pharmaceutical industry to do this properly and substantively for years. Or make your data anonymized, of course, make your data available to those who will do those analyses. So, incidentally, before I go on, I'm starting to round off now, to summarize our conclusions for the dog data. I think it's worth mentioning, it would be remiss of me not to, that we didn't just look at the dog. It was the major focus, but we didn't just look at the dog. We also obtained similar data for other species used in preclinical testing. Now, these data are the subject of a separate paper that hopefully will be published in the next few months. But I'm going to show you the INLRs from these two. Okay, here are the dog figures, as I've already mentioned. A very low, almost as low as you could be, median value of 1.1, and a very low range of between 1 and 2. We also looked at the rabbit, which was very, very similar to the dog. A very similar median INLR and a very similar range of INLR values. We looked at the mouse, which was slightly better, but still a very low median value, 1.39. Bit of a better range. The range goes from 1 up to 50, and possibly the most used species of all, the rat. Again, a better median value, 1.82, still incidentally incredibly low, but a better range. The range from 1 up to 100, suggesting that possibly the rat might be useful in a subset of cases if there's a pattern, which there may well not be, given that there wasn't in the dog. I think, interestingly, as well as this showing that all of these 4 species, the 4 species arguably that are the most commonly used in drug testing, are pretty bad. If there's no toxicity, it's telling you nothing about what you're going to find in people. And I think it's also interesting that the dog, which is used ostensibly to augment the data, seems to be the poorest species of all, certainly of these 4. So, wrapping up. Our analysis of the most comprehensive database of publicly available data on toxicity studies shows that dogs are extremely inconsistent predictors of toxicity in humans, and crucially, barely better than chance at their most important role of deciding whether or not a drug should progress to human trials, which of course is what we're looking for. We are looking for a predicted negative result in the dog. With respect to positive likelihood ratios, they were generally high, suggesting that toxicity seen in the dog is also likely to be seen in humans. Actually, in some contrast, incidentally, to the previous correlation studies that I mentioned earlier, this difference may be due, it's a moot point, at least in part, to publication bias. Our study, out of necessity, used publicly available data. A lot of the prior studies used data that was not publicly available from within pharmaceutical companies. The PLR values were, however, extremely variable, which must mitigate the reliability and the, if you like, helpfulness of the test. And I think it would also be interesting, as an aside, to see which of the true positives in the dog, if any, were captured by the dog that were not captured by the rodents. We don't really know this. There has been, I think, 1 or 2 studies in the past, very limited studies, which suggests this number might be very low. I think it was about 10% of drugs were terminated due to data in the dog that were unique, that were not seen in rodents. But the human significance of these dog data actually couldn't be determined in those circumstances. But more importantly, and again, I'm repeating myself, but this is a very important point. Though the INLRs, negative likelihood ratios, were substantially more consistent, they showed that the dog provided no evidential weight. In other words, if a drug isn't toxic in the dog, it provides no insight into whether or not that drug is going to show toxicity in humans. To repeat again, this is crucial. The critical observation for deciding whether a candidate new drug proceeds to testing in humans is the absence of toxicity in tests in animals. And our findings show that the predictive value of the dog test in this regard is barely greater than by chance. Now, really to finish off, this can be quantified. So, for example, suppose a drug is thought, based on prior data, based perhaps on its relationship to similar compounds and so on, to have a 70% probability of freedom from adverse reactions in humans. Based on our data, if that compound shows no toxicity in dog tests, then the probability that the compound will show no toxic effects in humans will have been increased by those dog tests from 70% to 72%. That's not statistically significant. The dog testing contributes no additional confidence in the outcome, crucially at a very high cost, both in monetary terms and, of course, in ethical and animal welfare terms. I don't think this is particularly surprising. We all know that drug attrition has increased drastically over the last, let's say, 2 decades. And that's probably due to the fact that animals can't really provide robust guidance on toxicity ahead of clinical trials. Many of the few drugs that are marketed will be withdrawn or relabeled also. And additionally, and I think this is quite bizarre given the heavy use of dogs in preclinical testing, precious little investigation has ever been conducted of how dogs' livers metabolize drugs. But what research has been done shows that there are significant differences between cytochrome P450 enzymes in dog and in human livers, the enzymes that metabolize the drugs. And this has been known for some time, and it's led some to conclude that, quote, "It is readily seen that the dog is frequently not a good metabolic model for man and is poorly comparable even to the rat and mouse." It's even known that there are significant differences in these enzymes between breeds of dogs. So if you can't extrapolate within that species, then it's going to be extremely difficult to extrapolate from dogs to humans between the species. Finally, it's argued by many, I think based on very robust science, that a comprehensive suite of more reliable alternative methods is available to drug development and should be more widely used in drug development. And combined with the things I mentioned this evening, significant public concern over the use of dogs, the high ethical cost of using dogs given their special nature, the desire actually expressed within the pharmaceutical industry by some to stop using dogs, or at the very least for the use of dogs as a second species to have a scientific basis as opposed to a habitual basis. We have to conclude that preclinical testing of new drugs in dogs cannot currently be justified on either ethical or scientific grounds. And just to finish off, I'd like to say that a move away from dog use therefore benefits not only dogs, but humans too. Thank you to the BUAV, Frame and the Kennel Club for supporting this work. Thank you to InStem for providing the data that allowed us to do it. Thank you all for your kind attention. Thank you very much.